We're looking now at the main body of your class, which the majority will probably be on the floor. However, the movement that we're going to look at now, we'll look at several different examples. Use whatever resonates with you. You could also do this if you decide to do your preparation phase starting on the mat. So very often we talk about the preparation phase being in standing, but there might be times when you want to do the preparation on the mat. But the exercise that we're going to look at is setting up BLEPS and looking at spinal mobility, finding neutral. So it's a really nice introduction when you come onto the floor. It can be used if you are doing your preparation phase on the floor. Now, some back issues, the flexion that we're going to do is mild. They will be okay. Some back issues don't like extension. And because we're lying flat on the floor, we will be going into extension that may not suit some people, particularly people with spondylolisthesis or stenosis, or people with facet joint impingement. However, don't stop them doing it. Maybe the first few weeks you wouldn't get them to do it, and then as the weeks progress, try them with it. And if it doesn't increase their symptoms, then allow them to carry on. But very often, and in my experience, I find people with stenosis and facet joint impingement can very often go on to doing both movements. But I've got a few people, well, more than a few, who come to me with spondylolisthesis and they really don't like any lumbar extension, but they all have spondylolisthesis in their lumbar spine. Some of you may need a pillow. So we're going to come onto the floor. Please, could I show you? If you have a client with back pain, or you have clients with osteoporosis, or you have new clients, or say for instance you get somebody who's had a hernia operation, or you have somebody who's recently had a baby, it's always better for them to come onto their side and to roll onto their back. Same coming up, they roll, then push with the hand. So if you have a beginner's class, that's probably how you teach them to get up and down. If you have a more advanced client who does not have any back pain, who does not have osteoporosis, they can come down with the roll back. Would you watch me first? My feet and knees are in line with my hip sockets. My sacrum is still. Now have a little wriggle around. Your sacrum is that big, it's like a triangle. Think of resting in the middle of your sacrum. It's at the bottom of your spine, either side of the pelvis. You're not at the top of it, you're not at the bottom, you're not on the right side or the left, you're in the middle. So if you're in the middle of your sacrum, you're probably going to be neutral. Arms are relaxed down by the side of the body. If it's comfortable for you, you can turn the palms up. Now I'd like you to address the neck. So for you as a teacher, you are observing every single bit of the setup. So if somebody's not correct, you can go and correct them as you do the setup. One of the most important things is we look at the neck position. Now you should be seeing the ceiling in front of you rather than seeing the ceiling behind you. So I would like you to consciously lengthen the back of the neck. Feel the chin is nodded. And can you see the ceiling in front of you? Look at your clients. If they can't get this position, so imagine that the neck is here, that will happen with a lot of people, men and women. With gentlemen, sometimes it's posture, sometimes it's muscle bulk. With ladies, very often it's posture. So if somebody's here, this is dangerous to keep people exercising in this position, particularly with women over the age of 50. So it might be that you have to use a pillow. Now, if you look at me, my neck is too high now. It's really comfortable, but I'm not in neutral. My neck is too high. So whilst you want the neck in line, you don't want the neck too high. So somebody might need a smaller pillow. However, if you have somebody in class that has got Meniere's disease or has vertigo, they might have to have their head higher because of medical reasons, because of anything that gives them a little bit of dizziness. Some people have to have their head higher. There's a lot wrong with my body, but my neck position's okay. You very often find if people have got ponytails in, they might need a pillow. So you're resting on the centre of the sacrum. Your arms are relaxed. Feet and knees are in line with the hip sockets. They're not right up to your bottom, but they're not a long way away. And you check your client's setup as quickly as you can before you start the pelvic tilts. So visualise your sacrum, that big triangle bit at the base of your spine. You are rocking to the top of your sacrum. Visualise that your tummy muscles sink down. They do not push out. Relax back into what we call neutral. Do that again. Can you roll to the top of the sacrum? Using your tummy muscles, but without gripping with the bottom. Relax. So as you kiss the top of the sacrum into the mat, try not to use your bottom. Ribs sink down and you are just sinking your tummy muscles and release. Take a little breath out. Focus on the sinking down. Little breath in through the nostrils. Little breath out through the mouth. Please notice that I taught the movement. I explained the movement before I added the breathing pattern. Layering the information. If I was dealing with beginners, then I wouldn't be asking them to breathe in a particular rhythm. I would just be making sure they did not hold their breath. Now this time, would you go the opposite direction? Have a look at me. It's as if I'm trying to get my hand under my back and I'm rolling towards the coccyx. I'm not forcing the tummy out, but there is definitely a lengthening. Now roll back to being in the centre of your sacrum. We'll call that neutral. Arch away. This is extension. And release to neutral. Now, if your client feels stiff in this position, it's okay. If it is painful rather than stiffness, then it may be that they don't like the extension. Ask them to do less range of movement or miss it out. So this is extension and we breathe in. Relax. One more time. Breath in and release. Now we're going to do the 3 movements. If one of the movement doesn't suit your client, they can just work on the other movements. Imprint, sink in. This is flexion. We call it imprint. No buttocks. Relax into the center of the sacrum. No activity. We call this neutral. Now arch the back away as if you're going towards the coccyx. We call this extension. Rest into neutral. Sink the belly button down. Exhale. Now inhale as you come into neutral and extend. Exhale as you come into neutral and flex. Inhale to neutral and extend. As you breathe out through the mouth as if you're breathing out through a little tube. And as you breathe in, feel you breathe into the ribs through the nose. Carry on, and if you get confused, please just breathe. So with beginners, I wouldn't talk too much about the breathing pattern, as long as they weren't holding the breath. Now feel you are in neutral. Relax. So your job would be to be observing your clients, and if necessary, getting hands on. A lot of people struggle to understand the movement. You might have to assist them. But it's a really good time to look at people's abdominals and check that when they're in flexion, they are sinking, not pushing out. It's an ideal time to get hands on, and you are observing your clients from all angles, but specifically observe them from the side. Let's have a look at a pelvic clock. Your arms are away, palms facing up. Imagine you have a marble between the belly button and the pubic bone. Be aware of your hip bones, the belly button and the pubic bone. Roll the marble towards your belly button. Roll it to one hip bone. Roll it to the pubic bone. Now roll it to the opposite hip bone. Just breathe subconsciously. Try and isolate the movement into the lumbar spine, but you will feel a bit of reactive movement elsewhere. The knees are going to move a little bit, but minimize it. Feel like you're rolling the marble around a clock face. So say 6 o'clock, right to 12 o'clock, but also going through 3 o'clock and 9 o'clock, and changing the direction of the circle. Which side feels easier? Does one side feel really smooth? Does the other side feel maybe different, or do you feel fairly equal? When I'm doing it this way round, I do feel I get a bit more movement in my rib cage. I'm not quite as good this way round. So this is a pelvic clock or pelvic circles. And release. Folks, the pelvic clock or the pelvic circles, if somebody has sacroiliac joint dysfunction, they might be better just with the flexion and the extension initially. So those are different exercises that can help people get mobility into the lumbar spine and also educating your group. But our aim is to eventually get the spine into the center of the sacrum, shoulders, jaw, neck relaxed, and they're probably going to be in neutral. But both of those movements need really clear observation from you as a teacher.